This video shows the cleaning and processing of a human lymph node. The cleaning and sectioning of the lymph node in this video was done directly after the tissue was removed from the participant. It was then taken to the lab for processing. For the RV398 and RV419 studies, the lymph node will be transferred to the lab in 20 ml of cold CRPMI on wet ice or cold packs within 1 hour of collection, to be properly accessioned into freezer works, cleaned and sectioned in the lab. Clean the lymph node by removing fatty tissue. This is the soft yellow colored tissue. Grasp the fatty tissue with the forceps and gently push the lymph node away from the forceps using the scalpel. The fatty tissue should pull away easily. Do not cut into the lymph node. If there is a suture through the lymph node, this can be removed by grasping the suture with the forceps, keeping the lymph node steady with the scalpel, and using the forceps to pull the suture away from the lymph node. You may have to cut the suture with the scalpel. Just be careful not to cut lymph node tissues. Remove as much fatty tissue as possible and the suture if necessary. If you are having trouble discerning what tissue is fatty and what is lymph node, err on the side of caution and leave any indiscernible tissue intact. In order to cut the lymph node into pieces for processing and preserving, you will be cutting on the vertical axis. Situate the lymph node so the thin side is facing up. Grasp the lymph node with the forceps to hold it steady. Squeeze slightly and use the scalpel to cut along the vertical axis to preserve lymph node architecture. It is very important to preserve the anatomy of the lymph node. You want to keep the piece of tissue with the best anatomy for preservation, and the rest will be processed for single-cell suspension. Place the tissue for preservation in 50 ml of 4% formaldehyde and continue to process the rest for cells. Transfer the tissue for cell processing to a pre-weighed Petri dish with 1 to 2 ml of cold CRPMI. Weigh the Petri dish again with the piece of lymph node. Record the weight on the lymph node biopsy processing worksheet. Once you have weighed the remaining pieces of the biopsy, mince the tissues by cutting across the width of the lymph node using the sterile forceps and scalpel or 2 scalpel blades. Ensure the pieces are very small. Clean off the scalpel blades using the media in the Petri dish. Place a cell strainer on top of a labeled 50 ml conical tube. Pre-wet the cell strainer with approximately 1 ml of CRPMI media. Transfer the minced tissues into the cell strainer. Rinse off the Petri dish with 1 to 2 ml CRPMI and pour over the strainer. Using the rubber end of a syringe plunger, disrupt the remaining tissues until there is only connective or fibrotic tissue left in the cell strainer. This will be the white tissue. As you are disrupting the tissues in the strainer, use a transfer pipette and CRPMI to wash the cell strainer and the end of the plunger. This will help to pass the cells through the strainer. This should be done a few times while disrupting the tissues. If the strainer fills with media, gently lift it off of the tube to release the vacuum and allow the media and cells to flow through. Once the cells are through the strainer, bring the volume of CRPMI up to 10 to 30 ml, depending on the size of the lymph node. Small lymph nodes should be in 10 ml and only very large nodes should be in 30 ml. You should be able to see a difference in color between media with cells and media alone. Centrifuge the cell suspension at 400 times G or 1500 RPM for 10 minutes at 4 degrees C with the brake on. Recentrifuge the pellet if it is not solid or if the supernatant is cloudy. Pour off the supernatant and resuspend the cell pellet in 10 to 30 ml CRPMI. Perform cell count and viability using trypan blue and a hemocytometer or an automated cell counter. Record the cell count. Samples can now be used for further immunological testing or frozen as described in the processing of lymph node biopsy SOP.